I want to welcome each of you to our Zoom presentation, Patient Empowerment Educational Series 2. We completed one, which was in May. We're actually getting ready to close out 2 in June, and we will start rather, part 3, which is in July. And so we are just honored to have each of you on the call today. Cancer Awareness Network is a nonprofit in Birmingham, Alabama, and My Style Matters, a nonprofit in Atlanta, Georgia area, have teamed together to present these patient empowerment series so that our patients and caregivers and even our healthcare providers could find some outlet, meaning, and educational tools as they move forward in their cancer journey. And so today is one of the many that we've had. And today's our speakers will be Tommy Blackburn, Abigail Johnston, and Colita Danner. Let me go ahead and introduce our first speaker today, and that's going to be Mr. Tommy Blackburn. Tommy Blackburn is a native of Chicago, Illinois, and currently resides in McDonough, Georgia. He is a United States Navy veteran and serves in the U.S. Navy as a hospital corpsman specializing in pharmacy. In his current role as one of the cancer treatment centers, he is responsible for preparing and mixing chemotherapy drugs for patients. He is a husband, a father of 3 young men, grandfather, and a friend to many. And so with that, I'm presenting to you Mr. Tommy Blackburn. You have the floor. Let's get you to unmute yourself, if you will, at this time. And while he's unmuting, let me just go ahead and mention, if you have questions for any of our speakers, please put those questions in the chat box, and you'll find it along the bottom icon of your screen. If you're on computer, I'm not sure where it is on the iPads or cell phones, but if you'll put those comments or questions in your chat box, at the end of the presentation, we will have a Q&A period so that we can ask those questions at that time. Thank you, Mr. Tommy. Go ahead.
All right. I just want to say hello to everybody. And I just wanted to talk to everybody and share my story of having cancer. I was diagnosed in October of 2018 with colon cancer, stage 3 colon cancer. And what's so ironic about it is that I've been working in the cancer field for the last 8 years when I was diagnosed. And it was, in the beginning, it was very tough. Me and my wife, we sat there, we talked, we discussed it. I just thought in the beginning that it was a death sentence. So I started my journey in November of 2018. That's when I had my colon surgery. And after the colon surgery, I decided to take chemo at the same place that I work at. And my first chemo day was in December of 17th of 2018. And what I remember most about that first day of having chemo is that coming through those doors after working with cancer patients for years, coming through those doors and realizing that now I was one of them. I was a patient. I was a patient, and I didn't know how I would feel as far as how my coworkers would treat me and how other patients would look at me. So that day was the beginning. And what happened from then on is that what I realized is that me being treated, and this is just my feeling of coming to be treated at a place that I work. The care that I received was, to me, above and beyond what I had envisioned. My coworkers, anything I wanted, they tried to do for me. They reminded me of things that I should have known, and it was the experience was just it was heartwarming to see that. My oncologist was also somebody who I worked with, and he made himself very approachable. He made himself very available. He was he made my transition from being a co-worker to a patient very, very easy. Starting chemo, after being out of work from the time I was diagnosed in October to the time that I started my chemo in that January, I had been out of work for 2.5, almost 3 months. So I started working a week after my first chemo. And I was getting my chemo treatments every 2 weeks. So what I was doing was I would come in, have my chemo I would take a day off to have my chemo. The next days of the week, I started on a Monday. I would have my chemo on Monday, and the next days of the week I would work. So patients saw me in the chemo chair one day and saw me working days later. That experience right there was that was another incredible experience, and it was heartwarming. It opened my eyes. It opened my eyes to seeing, to feeling what patients feel, to seeing what patients feel, to feel what they feel, and that experience of coming in and going through that. I approached the way I work differently. I approached the way that I approach patients and talk to them was different. It's just hard for me to explain that major feeling there of working one day and being in the chemo chair the next. And I had the type of chemo that I had to carry a pump 3 days after my appointment. So now the things that I went through that were not that I could share with you guys. The things that I went with by being an employee and a patient, some were not always good. And what I mean by not always good is that sometimes I felt like some of the treatments that they rushed it through because I worked with them. Some of the things I don't think I got the full. It was always because I worked with them, they put me first. I lost that feeling of being a real patient. I didn't like it. I did tell them, don't treat me any different. Just treat me like a normal patient. But the thing is that they didn't treat me like a normal patient. So that was one of the things that I know that I didn't get full advantage. I had one guy who I work with, and he's a counselor, and I remember him having somebody else call me, and I worked with him. He had someone else call me because he didn't feel comfortable of discussing certain things with his coworker. So those things are things that I didn't have an advantage of. But as far as having any paperwork and anything, so I did have an advantage of that. But going through my treatment and going through this chemo treatment and having cancer, it really opened my eyes to a lot of things. And now the way I'm always out, even though I work in a pharmacy, which we are tucked in the back, I'm always out on the floor, and I'm always talking to patients more, letting them know that, hey, you're not going through this by yourself. I'm going through this with you. I still have my port in. I show them that. I tell them that that I know how they feel. I know how they feel, and I've experienced it. I finished my chemo a year ago now, and in that 1 year, what I've been experiencing since my surviving it's survivorship if you can get past that chemo. The chemo is probably one of the roughest things that your body can experience. In that year, I still suffer body pains. I still have neuropathy in my feet really bad. It's the one that I could probably walk sometimes, but I feel my body feels as if I'm trapped in a paper bag and I want to kick myself out. But I am today. I'm still a survivor. I'm still working and talking, and I want to help anybody who have any questions about being afraid of their journey. The other day on my way to work, I was trying to think of what can I say when I come here. How can I end my presentation to you guys? And as I was driving here to work, a song came on the radio just as I was thinking about that, and it was by Beyonce, "I'm a Survivor." And there were certain things in that song that stuck with me, and I want to leave you guys with this as I leave this presentation, is that I'm a survivor. I'm not going to give up. I'm going to work harder. I'm not going to stop. I'm going to make it. I will survive, and I will keep on surviving. Thank you, guys.
Thank you so much. That was great. Thank you for sharing and just pouring your heart out. That was some vital information that I know all of our viewers can use. We don't have, we're going to do Q&A at the end, but I know Tommy has got to leave from what I heard. So is there any questions for him at this time? And if you can, go ahead and share your social media with us, or how people can contact you if they have additional questions, if that's okay. I think Tia can put it in the chat box for us.
I will do that.
Okay, awesome. And we do have some questions that came up in the chat box.
Okay.
So one of the questions is, do you feel that your treatments were substandard or above standard?
I feel that my treatment was above standard. They were above standard. A little rushed because I think they tried to make everything easy for me. But as far as the treatment itself, I got top notch. And it showed me a side of my coworkers. It showed that they really love me. And what I didn't say, and I should have said, is that coming back to work, I think really helped me in my process of healing, of getting better. Coming to work. Before I started work, for the 3 months before I started, I was depressed. I was not eating. I was just, I didn't know I had nothing to look forward to. But starting work during my treatment gave me something to look forward to every day. And I believe that really helped me. So yeah, I would say I got above level treatment.
Awesome. The next question is, what type of treatment are you doing for your neuropathy?
Neuropathy right now, I'm taking gabapentin, 300 milligrams, three times a day.
Wow.
And my feet still feel like they're on ice. So
yeah. Well, I think we can all feel your pain.
Yeah.
You know, some of us have gone through it, and some of us are still dealing with it. A follow-up question to the first question was, because your treatments was above standard, did it help you to understand more about disparities, especially for Blacks who have a higher incidence for colon cancer? Great question.
Oh, that's a good question. Because my treatment was above, I look at, and you know, I really look at how other patients with the same thing that I got, how they're treated. And to me, from my looking in, they're treated well also. It's just that with me, my reason I said above standard, because
they all knew me. They treated me well. Plus, it was good for me to get here. But the way other patients, and we have a lot of patients that come here, the minority patients that come through here, and their treatment, they get the same level of treatment that I got. And that's one thing I really, because I'm preparing the mug, I do go out and look and see and talk to the nurses, and they are everybody's getting here at this location. I know everyone's getting very good treatment. This is good staff.
And one other question I have for you, and it's not listed here, but it was a question that was sent to me, is being that you actually had relationships with your team, did you have to do a lot of questions, or did you ask a lot of questions, or did you put most of your trust within your care team because you work with them, you know that they're knowledgeable, or did you really have to do anything to really advocate for yourself and say, was it more of a patient provider decision for your care, or was it more based on what your provider said and you went with it?
Well, I'm gonna tell you this. I didn't ask any questions. My wife had a book full of questions. She asked a lot of questions. She asked questions that I knew the answers to, but she wanted to hear it from them. So as far as me asking questions, I didn't. I just took everybody's word, but that wasn't good enough for my wife. I mean, she made me see nutritionists. I had to go see, ask the doctor questions. She wanted to call, she took care of me. So as far as me asking questions, because I was familiar with everybody, no, I did. But to have somebody like that with me, she took care of that. She made sure things were done and right. Things were done right.
Awesome. Well, thank you so much for answering the questions. We'll move right along and we'll introduce our next speaker. Our next speaker is Colita Danner. Colita is a 29-year-old mother of a 6-year-old son. Throughout her life, has overcome many obstacles. At the young age of 8, she lost her mother to breast cancer and was raised by her grandmother, who was also a breast cancer survivor. At the age of 13, she was diagnosed with osteosarcoma. While growing up, she was challenged with having a low self-esteem as a result of having to wear a leg brace for stability due to having her fibula removed from being covered by a tumor. After finishing high school and going off to college, she got married and lost her first child at 33 weeks of pregnancy. Soon after, she learned that she was pregnant again and birthed a beautiful boy, Levi. When he was 3 years old, she found a lump in her breast, and after further testing, it was discovered that the cancer was actually in both of her breasts. While these past years have been very busy for her, she found herself having to have, in addition to the breast cancer, having to have a liver resection as well as a colon resection. Colita believes that without God, she would not be able to share her story, and it is thankful for her friends and family that continues to push and pray for her. Currently, she is finishing up reconstruction and getting care for her kidney and an ovarian cyst. She has faith that everything will be just fine, and through it all, she's a proud mom of her now 6-year-old awesome son. Colita?
That feels weird hearing somebody just read about my life. Hi, my name's Colita Danner. Like she said, I'm 29. I'm really shy, so I'm trying to get outside my norm. But basically, my mom died when I was 8. I didn't really understand a lot of things that were going on when I was 8, only because my mom always kept things to herself. So when she started losing her hair, I was like, what's wrong with mom? Like, I have 2 older brothers. They didn't really tell me. They just tried to keep me out the way. But my mom died one day when I was in school, and my brother picked me up. So I knew something was wrong because my mom was always there. Even when she worked overnight, she still made sure she was there for me when I went to school in the morning. So I knew something was wrong. So losing my mom was hard enough. But my grandma raised me. I grew up in the church. I didn't miss a single service, Sunday morning, Sunday night, Wednesday. I was always with my grandma. I was her shadow. So later she found out she had breast cancer too. So that's my mom's mom. She just had it removed. and she had radiation. So I had to go to her appointments. Just seeing little small things that she were going through. I didn't really understand again at the time, but I did pay attention to a lot of things that were going on. So when I later found out I had a bone cancer called osteosarcoma, which is a rare cancer, my aunt and my grandma took care of me. I really didn't have much I had to do. I just always kept hearing tumor, tumor, tumor. So I never really knew that my tumor was cancer. So trying to go to school, I was just an oddball. Everybody just didn't really come to me that often. Like I always stayed to myself. Like I was always shy because I had to wear a hat or I didn't have hair. So I had like a couple friends, but for the most part, I stayed to myself a lot. So dealing with that, I beat my cancer. They removed my fibula, so I have to wear a leg brace on my leg for the rest of my life, really. So I can't wear heels just like anybody else. Like most women love heels, I can't wear heels. So I'm more of into like tennis shoes, so that's what I like. But I got older, went to high school. It was kind of hard dating because I didn't think I was pretty enough, honestly. I tried to date here and there, didn't really do too well with it. So I just focused on school and just I tried to play sports, but sports was too much because of my legs. So I couldn't run track anymore. So just like a lot of things that I wanted to do, I couldn't do. So I kind of got depressed and I didn't want to do certain things. So I kind of isolated myself a lot. But I started dating probably towards the end of high school, got married, went to college for like a year. After that, I got married. After that, I found out I was pregnant. When I was 13, they told me I couldn't have kids. They said the type of chemo you had is just impossible for you to have kids at this time. So when I found out that I was pregnant, I was just like, wow, like I feel like my doctors lied to me. But my grandma always told me that God has the final say. So no matter what you believe, God has the final say no matter what. So when I found out I was pregnant, I was all happy. It was a girl. Her name was Cassidy. But I lost her when I was 33 weeks pregnant. They can't tell me what happened. They just said her heart just stopped. So at that time, I really didn't want to have any more kids. I just felt like that was just my angel, really. But then found out I was pregnant again. So I was like, goodness, like I didn't want to do nothing. I told nobody to come mess with me. Let me just have this baby. I don't care what you got to do. Just let me have my son. So found out it was a boy. I had my son. I was at the doctor all the time. I stay at the doctor all the time. I was like, look, I need an ultrasound every time I go to the doctor. I need to hear my baby's heart. So my son, he's 6 now. So he's doing really good. He plays football. He runs track. He plays basketball. So I won't say I'm living my sports life through my son, but he loves sports just as much as I did. So once I had my son, everything was going pretty well. Like my husband was in the military, so we moved a lot. We lived in Texas at Fort Hood and San Antonio. So we moved a couple times and then we moved to Hinesville, Georgia. He actually went to Korea. My son was 2 and I moved back home because I just felt like it probably wasn't a good time for me to be going out the country with a baby. So I came home. I got a job here. This was like 2015. I got a job. I was working. My son was small. So I always been like an advocate of making sure I was okay, checking on myself, doing my breast exams. And I just felt like a lump on my left breast. So I was like, okay, that's weird. So went to the doctor. They was like, oh, it could just be that you have fibrocystic breast. Never heard that before. So I was like, okay, I'm gonna keep an eye on it. I got an ultrasound. They said that's what they said. It was just fibrocystic breast. So that was like April. So by November, it was worse. So I was having nipple discharge. The lump seemed like it got bigger. I was just like, okay, look, like something's really wrong with me. And I'm the queen of Google. So I was on Google reading. I was like, look, I don't know what y'all think I have, but I was like, I know for a fact that this is breast cancer. I remember my mom telling me she had a lump. So I was like, look, it's something serious. So I really need to be seen about. Went back, got another ultrasound. This time it was like, okay, yeah, it's a lot different than it was before. Found out like the end of 2015, around December. That's when I found out it was breast cancer. And I actually found it in both breasts. So it wasn't just my left, it was on my right as well. They later just told me that I would have to have a double mastectomy, which was fine because I was like, I don't have anything up here anyway, so just get rid of it. I don't care. So everybody was like, oh, you can get new breasts, you can do this. I was like, you know what? At this point, I don't want nothing to do with breasts. I was like, they keep trying to kill the women in my family. I don't want them. So got my double mastectomy. I later found out that they had to take lymph nodes from under my arm as well. Because at first they just said once you remove it, you don't have to do any chemo or anything. But the lymph nodes being positive, then I had to do chemo. So doing chemo, my son, he just turned 3. So he's just learning really to start talking and everything. So he was my main support, only because his dad wasn't really, he was always out and about, like overseas, like he was in Korea at the time. So I found out everything when I was here in Decatur, Georgia. He came back from Korea. We moved to Hinesville, Georgia. So I picked up everything, moved to Hinesville, Georgia. I started my treatments, got a whole new doctor team and everything. The treatments was fine, only because where I was living in Hinesville, Georgia, everything was in Savannah. So I would always have to drive far for like 30, 45 minutes just to get a treatment. And I was doing treatments like twice a week. So it was starting to be overwhelming for myself because I wasn't driving. And then his dad being in the military, they would let him leave, but it wasn't as easy as you would think like another job would have. So it was beginning to be very stressful between me and him. So I was like, okay, look, I'm just gonna move home. I'm gonna go back to my family because it was hard being there in treatments by myself. Didn't have support. He would watch watch Levi while he was at home, and I had to go to treatment by myself. So I would see other families have like their husband, wife, like everybody would just have so much support. And I was like, why do I not have this? So I was like, I'm just gonna go home. Move back home. I had my grandma, my church family, I had friends, like it was just more support home. So I think my biggest issue, I had to learn how to open up, ask for help. Because I've never been the person to ask for help. I always been my own person. Didn't want anybody doing anything for me. If I couldn't do it for myself, I didn't need it. So I always learned to just start asking for help and being more open. So I moved back home. I picked up on my treatments, which is bad, because it's not good to just keep moving doctors because you have to basically retell your life to a whole different person. You got to make another relationship with someone. So that's always been an issue with my journey is I have to switch doctors a lot. Like I recently just had to switch my primary care doctor because they don't take my insurance anymore. So that's very frustrating to me when you have to keep switching doctors because, oh, they don't take your insurance anymore. It's like, it becomes overwhelming sometimes. But once you make a relationship with the doctor, I feel like you should be able to just stay with that person. But sometimes it doesn't work that way. But when I moved back home, the team that I had was like amazing. Like they always saw me as the baby. And I'm like, look, I'm not a baby. I got a baby of my own. But they always saw me as the baby because I was always happy when I came. Like, I feel like you shouldn't be rude to anybody that deals with your food or your health. So I always try to be positive. If I didn't know something, I would say something. I would ask questions if I didn't know anything. And I started bringing other people to the appointments with me. Emotional about certain situations, and they would hear it in a different aspect. So dealing with that, I finished my chemo. I had to do a year of Herceptin. So once I got to the year of doing Herceptin, that's when I decided I should, get a different job. So that's when I started working at a hospital in radiology. So I do scheduling. That was like the biggest. It's fun for me, but it's very over. How many times have I gone to the doctor and I don't know Why do I not know what type of medications I take?
Hey, Colita. I'm not sure if she can hear us. She's breaking up. Is anyone else experiencing her breaking up as well?
Instruction.
Okay.
I found out
Yes, her screen keep freezing.
Yeah. Colita, we're
something
having
on my.
some challenges
sorry.
hearing you now. Your phone
Oh.
or your computer is breaking up.
Can you hear me now?
Yeah.
Okay. Yes, ma'am. So, sorry about that. So once I finished my treatments, I found out that I had a polyp on my colon and I had a spot on my liver. So of course, everything that pops up in my body, I have to make sure that it's nothing cancer. So I had the colon resection. They took out a huge polyp. They found out it wasn't cancer, which was good. But I was in the hospital for like 15 days. I was in the ICU. They couldn't figure out what was wrong with me. Found out I had an infection. So I was in the hospital for a while. And then the spot that was on my liver was non-cancerous. So everything that comes up has been non-cancerous since. But it's just nerve-wracking because I'm like, why does everything keep happening to me? And my grandma always would be like, why not? Why not you? Like you're a strong person. So you get through anything because of God, because you have a story and a life to tell. And most people like, you have been through a lot just to be under your 30s, but I don't see it as that. Like I just see it as I'm trying to live to raise my son. But now currently I just found out last week that I have a cyst on my kidney and a cyst on my ovary. So now I have to see about that. And tomorrow I have my final reconstruction surgery. So like I still have going on, but I've learned to balance it out with my everyday life, work, and I'm blessed to still be working right now due to everything that's going on with COVID. So I count my blessings and I just keep moving and just go through the motion basically.
Awesome. Thank you so much for sharing your journey with us and how you had to navigate your diagnosis. We'll move on to Abigail and then we'll bring about all of the questions. I do see some questions popping up in the feed. So we'll come back and ask some questions. I know we were having some technical difficulties. So we'll jump to Abigail for the sake of time and then we'll ask everyone the questions after Abigail. So I'll read you all Abigail's bio so you know who she is. So in 2017, Abigail Johnston, at the ripe age of 38, while living in Orlando, Florida, she was diagnosed with stage 4 metastatic breast cancer after feeling a lump in her breast while tandem nursing her boys, who are now 7 and 5. In the summer of 2017, it was a roller coaster of emotions as she faced 4 body and life-changing surgeries amidst of chemo and radiation. Once the whirlwind had settled a bit and she completed transitioning her clients and staff at her law firm to another law firm, she and her husband, along with their 2 boys, moved to Miami to live with her family. While she is not actively practicing law, she uses her education and training in a variety of ways for the breast cancer community, advocating for patients and thrivers. She started a nonprofit organization called Connect for Legal Services, where she recruits lawyers to do pro bono work for stage 4 patients. She has a blog called No Half Measure and is active in many local and national organizations where she volunteers and adds her voice to educate and persuade others to connect with and help her community. Abigail, welcome.
Thank you, Tia. Thank you. So I'm on here from Miami, where it's over 100 degrees at 8 o'clock in the morning. So we are in the summer now. But it has been quite a roller coaster the last 3 years. As Tia said, I was diagnosed de novo metastatic, which means I never had an early stage diagnosis, stage 4 right out of the gate. And we have since discovered that that's because we have a germline mutation in our family. So a lot of people have heard of BRCA. We don't have BRCA, we have ATM. Which is a mutation that is linked to several other types of cancer, like prostate and ovarian and colon cancer. And my mother is a breast cancer survivor. So it has been quite an experience learning how to live with a terminal diagnosis, live with the knowledge that my next PET scan might show something very, very concerning. And for somebody who's always been a planner, for somebody who's always looked ahead to the next steps and is always thinking about what's next, it's been a huge adjustment, really having to live in 3-month increments, because I know when I get a PET scan each 3 months how the cancer cells are behaving themselves, if they are staying put inside my bones, because as of right now, my metastases are only in my bones. I don't have any organ involvement, which is something that we're trying to keep the cancer where it is. But living life in those smaller increments has been a big adjustment for me. And because my life and my career has been all about advocacy for others, mostly, I have found a different purpose, found a continuation of the purpose that I've had most of my life in jumping into cancer advocacy. And it began with advocating for myself. I really hadn't ever been ill or part of our healthcare system except when I was pregnant. And so it was a big shock to me, all of the things that I was having to deal with in my new life as what I call a professional patient. So instead of going to the doctor one time a year, I would be at various doctors' offices every week. And I began to see the pros and cons of doing that. So really, I began to see for myself that I had to speak up. I had a situation when I was initially diagnosed where I did not tell them about all the pain that I was having in my leg, and that delayed them figuring out that I was stage 4 by a little while because I was not upfront about that particular side effect or that particular symptom that I was feeling. And so one of the very first things that changed for me was I have to speak up. I have to tell them. I have to say, I had this weird thing. My eye was twitching the other day. You know, maybe it's nothing, but maybe it will help you figure out what's going on with me. So I think that was the first thing, that I had to tell them everything. And I haven't always been good about that. You know, sometimes it's exhausting. I have 14 different doctors, and I have the responsibility of making sure all those different doctors in their silos know what all of the other doctors are doing. And that's a big burden on a patient to remember to say everything. But I had to learn first. I had to speak up. That appointment doesn't work for me. That treatment regimen doesn't work for me. That timing of that test doesn't work for me. I had to speak up. I had to say those things. And then after I got a little bit more comfortable in saying those things, I realized I needed to speak up for other people, because the things that I'm experiencing, they're experiencing too. And I have learned over time that because I do speak up, and I speak up loudly, and because of my background as a lawyer, I'm pretty good at conflict without screaming and yelling and cursing. You know, I'm pretty good at cross-examining people to figure out exactly where they went wrong. And so I have turned that particular skill of mine into something that is helping my cancer center. So I prepared a 5-page spreadsheet of all of the things that they were doing wrong. And it wasn't just, here's all your problems. I had solutions, and I had done research as to the cost of those solutions. So I had a very, very detailed spreadsheet. And I called up the chairman of the board of our local hospital system, and I got a meeting with him and presented my 5-page spreadsheet to him. Now, at least half of that was the cancer center is not seeing or meeting the needs of stage 4 patients. And that was a big deal to me, being stage 4. I was diagnosed young at 38. I have 2 young children. They are presently 7 and 5. So my experience and my needs was very different from the people coming in who had grandchildren. So I really felt that that was missing. And so the chairman of the board set me up with a working group of basically all of the senior leadership at my cancer center. And I meet with them on a monthly basis to tell them about all the things they're doing wrong. But the thing that I have discovered by doing that, and by hearing the behind the scenes stuff, and by getting super detailed into what really went wrong in this particular situation and pinning people down, is that patients don't speak up. And these problems are happening to everyone. I know they are. I've heard other patients talk about the same problems that I've encountered, and yet the leadership isn't aware of it. And so now I try to make sure to communicate to everybody, fill out the comment cards, Fill out the comment cards if somebody was good. Fill out the comment card if somebody sucked. Fill out the comment card if everything was fine. But tell your cancer center, tell your doctor's office what's going on. My cancer center has thousands of patients, thousands of patients. They do annual surveys. The last annual survey, 103 people filled it out. And then they're making decisions based on the patient population, based on these surveys that nobody's filling out. So those two things, the comment cards and the surveys, they don't have the information if those of us who are patients don't tell them. The comment cards and the surveys can be anonymous. You don't get dinged for that, right? My husband is always a little concerned that as I speak up and tell people how they're doing things wrong, and don't always do it so nicely, that my care is going to suffer, or that people won't, my doctors won't want to see me anymore, that sort of thing. And that's a valid point, and that is a valid thing to be concerned about. Sometimes going to the patient advocacy offices means that certain doctors get upset. And so doing things anonymously, I think, is a great thing. But when your cancer center is asking you, what could we do better? I think that it really is incumbent on all of us to speak up and add our voices to that. Because I go into these meetings and I'm saying, look, this is happening, and I know 12 people that it's happened to. If I'm the only one complaining, then the validity of what I'm saying takes a bit of a hit. And so try to exhort everybody. Just reflect back to your care team how your experience is. As a lawyer, I'm also super concerned about notes and what people are writing down and that things are accurate and things like that. So getting a copy of your medical records and understanding how what somebody wrote down 5 months ago might be affecting how you're being treated. For instance, there are people who were trying to cover their butts, and they wrote down that they had repeatedly called me and I was not calling them back. This was about a scheduling issue. And so when I showed up for the thing that I had desperately worked hours and hours and hours to schedule, the person at the front desk, because she's reading the note that said that basically I'm an unresponsive, not responsible patient, she treated me a certain way based on what was in the notes. And so that is another thing that I've noticed, that if you have a weird response from somebody, that it could mean that there's some note in there that presents you in a particular light. And since we all have, legally, they have to give us access to all of our notes and all of our records. An easy way to just make sure that that's correct is to ask for a copy and make sure that the information in your permanent patient record is accurate. And then the other thing that I do as part of my nonprofit is I recruit lawyers to do free legal work for stage 4 patients. The interesting thing that I've discovered is that typically when people call me, I've been able to either coach them or outright just do whatever it is that they need, because 75% of the things that people contact me thinking that they need a lawyer, it's really about teaching them how to advocate for themselves. Yes, lawyers are the quintessential definition maybe of an advocate, but that level is not always necessary. Sometimes it's a point of understanding, what does your doctor do and what does the insurance company do, and how do you make that work together? How to apply for Social Security benefits and what needs to be in the notes before you do that. Accessing different private insurance. A lot of people have just had questions that relate to those things, and I'm happy to walk people through that. Most of the time, the issues that come about when people are running into brick walls is not as complicated as it seems. It's really relatively simple. And I see that there's a question about whether my cancer center has patient navigators. Thank you, Sanford, for that question. The issue at my cancer center anyway with patient navigators is that they target when someone is in that first initial active treatment and don't have the markers or benchmarks to check in with those of us who are going to be forever patients. And so because I transferred to my cancer center done with what they would look at as active treatment, I did my chemo, my radiation, and my surgeries in Orlando before I moved. So I moved to Miami, established this new team, and Colita, you're absolutely right about switching doctors and having to retell them all the stuff is a challenge. But because been done with that active treatment, and that was only where the patient navigators or the nurse navigators got involved, I didn't get one at all. And they did not have the benchmarks where they needed to check in with those of us who are stage 4. They do now, because I made sure that they expanded the times when they check in with patients to include when a person who's stage 4 has progression, when a stage 4 person begins a new type of treatment, when a stage 4 person simply changes medication, that triggers the nurse navigators to at least look at the person's file. The other thing that I am working on, and it's coming, is that every single stage 4 person at the appointment at diagnosis would get a stage 4 patient mentor, so that anybody who is newly diagnosed gets a patient who has walked through that journey with them from the beginning. And I talked to my doctors about this onboarding. I literally did this yesterday. A woman in Texas got my name and number because she's starting the medication that I'm on, and I admin the Picray group. I'm on Picray. And I talked to her for half an hour. She was sobbing at the end, like, why didn't my doctors tell me this stuff? And I said to her, it's because they don't know. It's because they don't live with this. I've been on Picray almost a year. I know how it feels. And so giving people that connection where they're connected with somebody else who has walked that path, I think is super important. And then Tia's reminding me to talk about my approach to my treatment, which is integrative, but I don't have an integrative doctor. So when I mentioned before that I have 14 different doctors, some of that is because I have a naturopath, I have a chiropractor, I have a Chinese medicine doctor, I have an acupuncturist. I have these people, a massage therapist as well. I have these people who have their fingers in other things that's not traditional or Western or mainstream. I also use medical marijuana to manage my pain, and I'm not on any narcotics. And that is a choice that I have made because I have little kids. So I try very hard to make sure that whatever I'm doing is somewhat rooted in science, right? There are some things that aren't rooted in science, but I try to make sure that whatever I am doing is rooted in science. And then I tell every single doctor, every single thing that I'm doing. So if I'm doing something with my Chinese medicine doctor with herbs or tinctures or something like that, I'm telling my pharmacist, I'm telling my medical oncologist. My medical oncologist made fun of me for months using medical marijuana, and now she refers people to my doctor to get medical marijuana because she saw that my pain levels were coming down, that I was able to stay very present with my children, and it was something that was a reasonable alternative because I was doing it in a safe way. In my experience, doctors say no, or doctors counsel you against things that it's because they don't know. So I've learned with my doctor, love her to death, she's Chinese, and she's very, very rooted in the allopathic model, very, very rooted in where's the study, where's the science. If there's not science, it doesn't exist. And so what I do with her, and what I tell everybody to do with their doctors, I say, okay, tell me why you're saying no. If she gets to the point of admitting, and it's hard to get her to admit it sometimes, that it's just because they don't know, then I say, okay, will it hurt me? Do you know of a reason that this would hurt me? Now, a contraindication with the drug, that's a no-go, right? But understanding why there's a contraindication, and if there's a way to work around it, those are now the conversations that I have. And I have found that once my doctor trusted me, trusted that I wasn't going to do something weird, trusted me that I was going to follow her instructions, trusted me that I'm going to follow the prescriptions, that whatever adjustments we make, that I am compliant with it, she was able to take a step back and observe what I was doing. And right now, I'm on an experimental combination of medication that I proposed that has no scientific proof to it, but I just had the best PET scan I've ever had in 3 years. And I believe that that is because I have taken responsibility for my care. I've taken responsibility for the decisions that I make. I look at all my doctors as my consultants, and I tell them that I make the decisions. You're advising me. I want your advice, but I make the decisions. And the doctors that are willing to participate with me in that give and take, that partnership, knowing that I bring the expertise for my body, I bring the expertise of now 41 years of living in this skin and how my body reacts to things, that is just as valuable as the medical and scientific knowledge that they have. And once I've gotten to that point with my team, I no longer feel like they're trying to impose things on me. They make suggestions to me, and they'll make suggestions strongly when they believe that. They justify and explain their recommendations, and then we move forward in the best possible way for everybody. Another question about my cancer center. So yes, my cancer center, the Miami Cancer Institute, it's new, but it is in partnership with Sloan Kettering. So it does have some hospital affiliations that way. And there are many trials that are happening, including trials looking at specific herbs. And then because I'm in that system, then I also have access to whatever Sloan Kettering is doing. And I've participated in a couple of trials through there to get genomic testing, as well as donating my tissue, in light of the fact that because I have the ATM germline mutation, they're wanting to understand more about that as well. So while I have not been in any drug trials yet, whenever it comes to a point of looking at the possibility of progression at each PET scan, my doctor, I mean, I have a list of about 12 different medications or trials that I think would be next or in the pipeline for me. And my doctor and I discuss those regularly. I see her at all the conferences. I see her in San Antonio, and it's been good to see how committed she is. But then because she sees me there too, she knows that I'm holding up my end of the bargain and also taking it very, very seriously as well. All right, so Tia's asking, how did I break the news about the diagnosis to my family? So the very first day that I knew that I was stage 4, we called my parents and cried and cried and cried and cried. And then I called each of my siblings. I'm the oldest of 6. And so I think generally how I did it was to be as in person as possible. It was on the phone to tell at least my family individually. And you know, I'm a pretty matter of fact. I always forget with right brain or left brain is which one. I am the not creative one. I am the like 1, 2, 3, 4 logical sequential person. And so that's how I told them. You know, this is my diagnosis. This is what I know right now. Yes, this is a big deal. You know, we're going to deal with it, kind of thing. I fell apart later with my mom mostly. But that's how I approach life typically, is to try to understand things from a logical perspective. And then I will feel the feelings later. And that's really how I've tackled cancer in a lot of ways, is the more I know, the better I feel about making good decisions, the better I feel about having hope, the better I feel overall.
Thank you so much for answering those questions. We did get some questions that came through, and I was trying to add them to the chat before the actual presentation. So I wanted to read the questions both to you and Colita. So one of the questions that actually came in the chat, and I'll throw this one to Colita. And this was, let me scroll back up. It was about genetic testing. So the question is, it was 2 questions that came to you, Colita. As a young cancer survivor and having family history, has anyone talked to you about having genetic tests? And then to add to that question, the other part of that question that was asked was, oftentimes families don't talk about cancer. Did your family ever talk about cancer and the risk factors? So those questions kind of go together. So Colita, that's a question for you.
For my family, no, they didn't really talk about cancer. I feel like with my family, we don't talk about personal issues. I mean, that's not really a personal issue because it does affect everyone around you. But growing up, my grandma always taught me what goes on in your house stays in your house. So my mom never really talked about having cancer with anybody. Like she didn't tell anybody, like nobody. Like the only reason why I noticed is because she was changing physically. And like she gained weight, like it was just little small things that you would notice. But for her, she didn't tell anybody. My grandma, she didn't tell anyone. Like I went to church once, and Sunday school, I accidentally said, pray for my grandma's cancer. And everybody was looking at me like, what? Your grandma got cancer? And I was like, oops. But it's just my family didn't really talk about certain things. And I've noticed that a lot of other people, families, they don't express certain situations because I don't know, like some people, you don't want them to see you as, not saying that you're weak, but you always want that strong person mindset. Like you don't want anybody looking at you like you need help all the time. Like my family always just keep a strong mindset. And as far as genetic testing, I did. I didn't get genetic testing until after I found out I had cancer. And I do have leishmania. It's the mutation of TP53. And basically it's just saying that you'll have cancer at least 3 times out of your life. And I've already had it twice. So I'm at the high percentage for ovarian cancer. I can have breast cancer again later on in life. Osteosarcoma is on there. So it's just, my factors are really high.
All right. Another question. Have you noticed the difference in the number of African Americans treated with alternative medicine, especially for marijuana for pain? Colita, is that common in our community? We are currently working to get past this barrier to our healthcare. And I think I want to add another question to that. And thank you so much, hearing you share that your family hasn't talked about it, but I appreciate that you are willing to talk about it. You have a son, you have 2 brothers, and at some point, having these conversations will help us to break down some of those barriers for things like genetic testing, maybe your son. How are you kind of managing it now, knowing that you are a higher risk for recurrence or being diagnosed with a new cancer? What are you doing now to help try to lower those risks or be preventative, as people would say?
Right. So I follow the leishmania schedule. So basically I have a full body MRI every year. I have to do pap smears every 3 months. It's just little small things that I have to do. So I'm literally at the doctor like at least every other week. My son, I haven't gotten him tested. Yes, ma'am. So my job, I don't even really have to say much. I like, look, I got an appointment. They're like, just go. But as far as my son, they told me to get him tested at half of the age where I found out. So he's at the age now. So within the next couple months, I have to get him genetic testing done. As far as my family, nobody else has gotten any testing done. Because really, I'm like the only one that keeps having stuff popping up. Everybody's fine, but I wish they would be more active about it, but we haven't gotten there yet. So me being more open about it is like the first step within my family. So yeah.
And this question is to Abigail. What are some good integrative methods to choose? And then I'll add this other question to that. What is integrative treatment?
So my understanding of integrative treatment is that you look at the traditional model, which some people call Western medicine, which is symptoms leads to a diagnosis, leads to treatment. When you look at the functional medicine model, and that model is really what you see more Eastern medicine, which is you look at the body first, and you look at what's working in the body, and you look at what is preventing the body systems from working properly. And I really like this because it goes back to this idea that God created our bodies to work. And if it's not working, then there's something about the original way that our bodies were designed that may hold part of the solution. And so thinking about, is my lymphatic system draining properly? Is my, do I have heavy metals in my body that's blocking the absorption of something good? There are a lot of medications that you can test to see if you can actually absorb it well. They use this to see if people are absorbing tamoxifen. And when I was working with foster kids, we used that same test to look at which psychotropic medications would be absorbed well. So we weren't trying 12 different medications. We were going straight to the medication that worked. And so I believe that looking both at making your body function better, as well as treating symptoms, that has to go together. Otherwise, you're just piling on more drugs to treat all the different symptoms. My father-in-law is in a nursing home, and they do that. So he'll get one drug, and then he'll have 12 side effects, and so he'll get all these other drugs, but then he has more side effects. And so what I do on a regular basis is I make them stop some of the medications so that we go back to where is his body really at right now. So that's what I think of when I think of integrative medicine. My purpose in treating the symptoms that I had was much more about pain. And so I followed through on the things that were helpful for that. So, but then I got all kinds of other benefits, right? I went to acupuncture to reduce inflammation. And frankly, my digestive system has never worked so well. And she's able to identify weaknesses or points in my body where I need extra help. So I don't always fully understand all the little things, like how does sticking a needle in my head help my liver? I don't know. But a lot of it, it really does help. What I see generally, and you know, my husband is Jamaican American, so he has those experiences as a Black man seeking medical treatment. And I do see that I am offered different solutions at times than people in my same situation who are different. Now, we have a lot of Hispanic Americans here, and so language can sometimes be a barrier. But generally, I see doctors treating minorities they make assumptions that they don't want something extra, that they just will take whatever they're saying. And so that's where my method of trying to help with that is I speak up anytime I possibly can about using these alternative things so that it is looking more mainstream, it looks more acceptable. I'm educating my doctors on all these other things that I'm trying so that then if somebody else says, oh, what about X, that maybe they're going to be a little more open. I think it comes back to a certain amount of self-advocacy. I think it comes back to a certain amount of, is that really the only option? I think doctors need to hear that question more often. They're used to just kind of throwing out the general stuff, but not really considering the audience, or not considering like this person has children or this person has this kind of life. I think part of self-advocacy is simply asking the question, is that the only thing that could help me, or is there something else I could look into?
Yeah. It sounds like, you know, doctors should focus, kind of listen to you in my own personal journey, you know, stop focusing on treating the cancer, focus on treating the person, the whole person. Yes. Because every person is different, right? And so if they're just treating, okay, this is, you know, triple negative breast cancer, and we know that we're going to throw Taxol at this person and, you know, Adriamycin at this person, well, it may not work for that individual person. So treat the person and not so much just the disease. We have one more question.
Person, right? We're not just cancer.
Yeah, absolutely. The question was for you, and this was centered around the marijuana and alternative medicine. And it was, have you noticed a difference in the number of African Americans treated with alternative medicine, especially for medicinal marijuana for pain?
So in my experiences, because there aren't as many here in Miami, just generally, I have not noticed anything in particular here. I mean, I've been in a lot of conversations with, for the Breast of Us in terms of what they're doing. I'm working with another group of people about palliative care, and really looking at the idea of palliative care in the communities where there may not be people so comfortable asking their medical oncologist, whereas palliative care is a little bit more of a relaxed environment, at least in the team way that this Dr. Worcester up in Pennsylvania is doing it. And so with that project, the idea is to duplicate what she's doing in other cancer centers that then could become hubs. And then we could see some more of the palliative care extend into the rural areas, which is where it's really lacking. But in my experience, my palliative doctor is the doctor who looks at me as a whole person. I get 45-minute to an hour consults with her versus 15 minutes with my medical oncologist. And so she has the space, she has the time, she has the training to look at me in a different way. And so I do think there's a role for palliative care, as soon as people stop thinking about it as hospice, to come in and help with that full, like, look at you as a whole body, a whole person. And my idea of doing the patient mentors, having an experienced stage 4 patient at that cancer center to then sit down with whoever is newly diagnosed and say, don't forget about these other things. especially because you're not thinking initially. So those are the efforts I've taken to look, at least at my cancer center, look at where people are falling through the cracks, and then have the programs that that would help with that. So that's at least been what I have been able to offer, but I'm very much open to other opportunities and other discussions.
And thank you so much for mentioning hospice and palliative care, because I was going to say that a lot of times people hear palliative care, they think automatically hospice. So definitely, hopefully we're able to, and the work that you're doing will change that narrative around palliative care. One last question and then we'll wrap up. The last question is around, and this is for you, Abigail, how much collaboration have you done with advocacy groups or organizations that represent Black women with stage 4 breast cancer?
Yeah, so For the Breast of Us has been the organization that I've been in some talks with. The organization Compassion That Compels, For the Breast of Us and Compassion That Compels, we're talking about doing some presentations and things on these racial disparities, and I'm doing a lot of writing for that. I'm working on developing some curriculum for training mentors for after breast cancer diagnosis. That's an organization that specifically mentors or recruits mentors and then connects them with mentees. So working on updating their curriculum, not one to be more inclusive of those of us who are stage 4, but also to include those other disparities so that more people are being trained to look for those things, to spot those things. So those are the things that I have in the works right now outside of the palliative care project.
Awesome. We do have one more question. I did say that was the last question, but it just popped up, and I'll let this one be our last question. And this is for Colita. What advice would you give someone newly diagnosed with breast cancer in their early 20s? I thought that was a great question. So we'll pitch that one to you.
The best advice, so early 20s, I would say try not to have your life wrapped around having cancer. My biggest issue was me trying to do so much at one time rather than trying to enjoy life. Like, I missed out on a lot of things that other people my age would have done. So I feel like you should try to keep your life as normal as possible. So hang out with your friends, go to the movies, go just have fun. Don't let that dictate your life just because you have cancer. Like, still just do whatever. I have a friend, she got diagnosed at like 22. So I reached out to her. I saw her on the news and I was fascinated by her. I was just diagnosed. So it's okay to reach out to people you don't know. Now she's like one of my best friends. Find people on Instagram, Facebook, it doesn't matter. Like, just have conversations with people, reach out to them. It was try to look up like double mastectomies and try to find people that look like you and try to compare the situations, because not everybody's regimens are the same. At least you have your on what to expect for what you need to do, and you just go from there, because everybody's treatment's going to be different.
That was great advice.
At least you'll have on it.
Oh, sorry. That was great advice that you shared, and I think that's good advice for not just people in their early 20s, but everyone. Last question. This is it. Final question, I promise. And this is a question for Tommy. He's still on the line. Do you provide any outreach and education to Blacks who are at risk for colon cancer? Maybe he's still working. He's unable to unmute.
You're muted.
Oh, there. Let's see if he's.
You're muted.
Yeah. I'm trying to see if he's still on the line. Okay, yeah, he's still here. I didn't know if he had to step away. Let me see if I can unmute him.
And I was really curious because he's a Black man. Okay.
There you go. Tommy, I don't know if you heard my question, but do you provide any outreach and education to Blacks who are at risk for colon cancer?
What I've been doing is that anytime I see anyone that's my color, in my age group or younger, I try to let them know that how important it is to have a colonoscopy. And like I said, I do go around and I talk to people. I've done a few fundraisers in the past And I tried passing knowledge on and giving people knowledge is probably the best thing that we can do, because I know it took me a long. This was my first colonoscopy when I found out I had cancer. I was 54 years old. So education and letting younger people know that how important it is to have a colonoscopy, because in my case, they probably wouldn't have picked it up at 50, but in other cases, you can pick it up at much younger ages. So I just try to pass on that knowledge. And like I said, and I try to talk and share my story with as many people as I can, and as many young Black men as I can. And Tia, just like I reached out to you, I try to reach out to everybody. I've always, from the first time that I met you, I didn't even have cancer then. You had cancer then. And I talked to you because I wanted to hear your story. I wanted to see if there's anything I could do for you. I wanted to see if I could answer any questions. And that's what I do. That's how I try to do it. And I try to do that for everybody. Now that I'm a patient also, so I had to change that.
Yeah, and what's interesting is when Colita brought up connecting with people, you know, on social media. When I was actually diagnosed, I found Tommy on social media. You know, I think we were in like some group together, and I reached out to him and I basically said, hey, you know, I have just been diagnosed. I see that you work in, you know, in oncology. Actually, you're at Atlanta Cancer Care. Hey, can you talk to me? Can we talk offline? I have some things that, you know, questions I have. So yes, this is, you know, great to continue to connect. Thank God for social media, right?
That's right. Powerful tool.
Awesome. So I'll turn it over to Miss Loretta now to wrap us up.
Okay, thank you so much. This has been very fulfilling, very enriching, and just thank those speakers. Each of you have really shared a wealth of information, and it's just so amazing. I was listening how the connections are made, and I think we always connect that way. Sanford James out in Texas is always on supporting us, and there are others all across the nation, and we're just so grateful for that. I do want to give a sponsor's shout out to I can't even say it, Amgen, who is our sponsor for the talks that we've been doing, and we thank so grateful for what they have done to support us. And so there are no other comments. I think, oh, we do have winners for each of our events. So one of your names will be put in a drawing. Well, all of your names will be put in a drawing. And once the winner is determined, you will be getting a gift from us. And that gift is going to come through one of our sponsors also. So we're just so grateful for that. And
yes. And I was going to say, and that sponsor is Stronghold Ministry. So you'll receive a gift basket. Yep.
Right. Stronghold Ministry. And thank you so much, guys. We really appreciate you. And so have a good day. And thank you to our speakers.
Great seeing you, Abigail. Bye.
Right.
And Loretta, as usual.
Yeah.
All right. I'll be in touch.
Thanks, everybody.
Thank you.